This is Tally, and I'm going to be doing a quick talk through of how to do trach suctioning. And in the previous video, I did nasopharyngeal suctioning, and it's very similar to that procedure. There's just a few minor differences. So with trach suctioning, you're going to be starting at the nose and going to the earlobe to measure your tubing. So that's one of the main differences, is just your tubing measuring is different from that. Just like with any other basic procedure, you're going to go in, do your ADIT, do your hand hygiene, make sure you did your checks and your rights, you have your right patient, you get their bed up into the semi-Fowler's position, just like with the nasopharyngeal suctioning, so that doesn't change, it's the same position. Also, again, you want to make sure that they have that linen over their chest so that they don't get anything on their clothing or on their bodies. Next, you can check your suctioning and just make sure that the pressure on it's working, and also that those numbers stay the same. So with adults, your suctioning is going to be 100 to 150 millimeters of mercury. For children, it is 100 to 120 millimeters of mercury, and for infants, it's 50 to 95 millimeters of mercury. At this time when you're doing all this, you don't have to have on your sterile gloves because this is not the sterile part, so you can just have on your normal regular gloves that we always use. So with these gloves on, you want to go ahead and make sure you have all your equipment out. You can, and again, check that suction on the wall, make sure it's working. Go ahead and pour your saline that you have into your bin, and then when you have all your equipment ready, then you can put on your sterile gloves, and once you do that, you can get your tubing connected. So like I said in the last video, your dominant hand has to stay on that catheter, and then your non-dominant hand is to the tubing that's on the wall. So you're going to want to connect those two and make sure that they're connected right so that suctioning happens the right way. And again, the hand, my left hand is my dominant hand, so that's the hand I'm going to use for the catheter. So that hand is my sterile one, and then my right hand is my dirty one that I can use. When you go to insert it, make sure that you're going about 0.5 to 1 centimeter past the distal end of the trach, and that you're not going further than the carina. So make sure you're stopping at that point, and also before you do that, make sure your catheter is dipped into that saline and it has lube on it. So once you start withdrawing your suctioning, you can't start like your suctioning it, like you start your suctioning while you're withdrawing, and you can do that for no longer than 15 seconds. So if you do this for more than 15 seconds, you have to stop at that point, give them a 30-second break, and then if you have to go more than once, make sure you're not going past 5 minutes. So that's your key, 15 seconds and 5 minutes. Don't go over 5 minutes, and don't go over 15 seconds. As you pull out the catheter, you're going to roll it between your thumb and your forefinger when you take it out, and make sure you detach that suctioning like before you go to pull it out so that it's ready to come off, and make sure that the tubing is in your dominant hand, and you can roll it up and dispose of it in your glove at the same time, so you don't have to touch the tubing with any of your bare hands. So make sure it's in that dominant hand, and you can stick your hand in and dispose of that glove and the tubing at the same time into your trash can. So that tubing is going to have there's secretions in it where the suctioning came out, so you can dip that into your saline and it will clean it out fine for you. Once you're finished with that, you're going to want to turn off your pressure, do hand hygiene, provide mouth care, whatever they need, any kind of care, give them their call light, put their bed back down to the position that they prefer, and make sure that they're comfortable, and do your periodic checks on them. And that's it. Thank you.